You probably have some questions about Invisalign Teen. What are some of the common questions that we hear that people ask us every day? Yeah, one of the questions that maybe a really obvious question you might have is, will it affect my speech? Will my friends be able to tell a difference in the way I talk? Am I going to be able to stand up in front of my class and give a paper? Well, you know, I used Invisalign, and it was very effective, and I talk all day. I'm talking to patients, I'm talking to parents, and you know, some of the people on my office staff didn't even know that I had Invisalign in my mouth. So it didn't affect my speech at all. Not everybody is the same. Some patients tell me it takes them a couple of days to really feel that their speech is comfortable with Invisalign. But then the same would be true of regular braces. It takes a couple of days to adapt to anything new. Do you have glasses? Probably took you a couple of days to get used to those. So yes, it takes some adaptation, but there's very, very little effect on the way you speak, the sound of your voice. You probably have some questions about Invisalign Teen. What are some of the common questions that we hear that people ask us every day? What about getting cavities? Is that a greater risk with Invisalign than with regular braces? Actually, no. There's less risk with Invisalign. The reason is that regular braces being attached to the teeth have a tendency to accumulate food particles or what we call dental plaque. You know, that kind of white scuzzy stuff that gets around the margins of your teeth. That can be difficult to clean. Not impossible, and most of our patients do a really good job with regular braces. But that whole issue is eliminated with Invisalign. In order to brush your teeth, you simply take the aligners out. They're rinsed under cool water. You can brush them with your toothbrush and brush your teeth and then put them back in immediately. So our experience is that there's a lot less tendency for dental decay or for gum tissue irritation with Invisalign than with regular braces.
That sound's going to be on there. Probably going to pick it up.
About cavities. Nobody wants to have cavities. Is it any different with Invisalign than with regular braces? Are people that are having Invisalign treatment any more prone to having decay than with regular braces? The answer is that with Invisalign there's less potential for having decay during orthodontic treatment. Why is that? Well, as you probably know, regular braces, metal braces, are attached to the teeth, and so it's really easy for food particles and what we call dental plaque to collect around the braces, and that can cause early decay. We give patients a lot of toothbrushing instructions so that they're able to do as good a job as possible, and in fact very, very few people with regular braces have any decay at all. But with Invisalign, that process of brushing and flossing is even easier. You can kind of picture that. With regular braces, they're in your mouth when you're brushing. With Invisalign, you take the aligners out, set them aside, brush your teeth thoroughly, put them right back in, and they continue working. So there's less chance that any food particles or any dental plaque will collect around the Invisalign aligners. You probably have some questions about Invisalign Teen. What are some of the common questions that we hear that people ask us every day? What about sleeping? Can Invisalign aligners be worn during sleep? Absolutely yes. That's actually the easiest time. When you're asleep, you're relaxed, and they're doing their work and you don't even know about it. So wearing them at nighttime, no problem. Easy to do and comfortable. You probably have some questions about Invisalign Teen. What are some of the common questions that we hear that people ask us every day? So how long does Invisalign treatment take? It's different for every patient, and that takes a fair amount of careful study and planning in order to figure it out. But in general, Invisalign treatment and treatment with regular braces takes about the same length of time. It's done with a series of aligners that are carefully planned to produce little tiny bits of movement over time. We usually start each patient with a set of aligners that they will wear for 2 weeks. We generally give patients 3 sets of those aligners, and we see them about 6 weeks later to make a decision about whether we should move to the next series. In some cases, we're able to decrease the amount of time that each set is worn. Sometimes we have to increase that time depending on the individual patient response. But in general, each set of aligners is worn for 2 weeks, and we see patients at about 6-week intervals. So it's about the same as with regular braces. About every 6 weeks you have to come in. The orthodontist will have to check your progress and make decisions about the next steps to take.
How about
you probably have some questions about Invisalign Teen. What are some of the common questions that we hear that people ask us every day? You probably have some questions about Invisalign Teen. What are some of the common questions that we hear that people ask us every day? You know, one of the questions that I have in my mind that I don't think any teenage patient has ever asked me is, will it affect me if I kiss my girlfriend or boyfriend? I have a lot of experience with that.
Oh, this is so good.
So how can I answer that? Well, I've got a lot of experience with that. You know, my experience is it does not affect your kissing at all. So relax about that part of it. Well, you know, one of the things that we're all concerned about is with things like this, whether it's our cell phone or our glasses or our wristwatch or anything else, is what if we lose it? What happens? Well, with Teen Invisalign, actually, we have an arrangement with the Invisalign company that if a teenager loses 1 or 2 sets of their aligners, we could replace it at no charge. So that's not really a problem. That doesn't mean we encourage people to lose them, though, because that interferes with the treatment progress and might extend the length of time that it will take to create your final beautiful, healthy bite. But we give each patient a little case to keep their aligners in, so when they take them out, they put them immediately in the case. Don't put them in their pocket. Don't drop them in their book bag or leave them on the tray at lunch. It's always either in the mouth or in the case. And I'd have to say that over a period of treating hundreds and hundreds of Invisalign patients, I've had very, very few that have lost any aligner. Yeah, maybe one of your questions is, what about my breath? You know, I have bad breath. I certainly don't want to have bad breath. Well, as long as your teeth are brushed thoroughly on a regular basis and you keep the Invisalign aligners clean and follow our instructions about that cleaning, it should not have any effect on your breath. Your breath will be just as sweet as always.
Do you have to get impressions made all the time?
One of the questions that both parents and teenage patients ask us, well, do I have to have those impressions taken? Well, the answer is yes, at least once, and maybe twice, and in rare situations, 3 times. But the technology for that has improved significantly, so it takes very little time to do. Most patients find it completely comfortable. Maybe the first time it feels a little strange, but once you've done it. I know you're a good student, and you're concerned about your grades, and you want to always be in class on time and not miss much school. So one of the questions that always comes up with any kind of orthodontic treatment is, well, am I going to have to be out of school? And the answer is you probably will for some appointments. In general, what we try to do in our practice is schedule longer appointments that occur infrequently during school hours. And then the shorter, more frequent appointments, we try to schedule after school. We schedule on school holidays, at times when you have, like during the summertime. So the reality is that most teenage patients end up missing very little school during the time they're under orthodontic treatment.
How long are the visits?
You might wonder how long you'd have to be in the office, in your orthodontist's office for Invisalign treatment. There are some long appointments that could last as much as an hour. A few, maybe 3 or 4 over a 1.5 or 2 year period of time. Most appointments for Teen Invisalign take less time than appointments for regular braces. In most cases, appointments are 15 minutes, 20 minutes, at the most a half an hour, and they are usually about every 6 weeks.